Hello, hello. I hope you guys are doing well. My name is Dr. DeLon Canterbury, and I am a board certified geriatric pharmacist and founder of Geriatrics, where today we're going to be talking about the impact of overprescribing and how people like you can find ways to advocate for less harmful medication use. And so we will be covering the power of deprescribing. As a pharmacist, this is one of my favorite topics to share with you. So we're going to talk about a little bit of the history of prescribing and the prescribing habits and why is everybody on a medication. So it really helps to have a pharmacist serve as your best friend when it comes to education and advocacy around ways to get yourself off of chronic medications. So let's dive into it, okay? What exactly is overprescribing? Let's talk about the problem that we're seeing firsthand. I'm here based in the Carolinas in America, but overprescribing has problems all over the world. In fact, the World Health Organization ranks medication side effects, harm, and errors as one of the number 3 public health risks in the entire world and threats to humanity. So the issue is, we do have a drug problem, and I mean a prescription drug problem here today. So in the US alone, about 1 in 3 adults are on at least one type of medication, where about 20% of all people in the Americas are taking at least 5 chronic prescriptions. So what does that mean? As we get older, as our bodies age, we simply do not break down those drugs the same way like we used to. And so we end up seeing, particularly in our older population, our senior population, medication lists that are 10, 15, 20 drugs long. And that is associated with an increased risk of harm, side effects, falls, and cognitive impairment. And unfortunately, in our US system, we have a lot of barriers that keep the power of deprescribing, the safe removal of harmful prescriptions. It tends to be a bit hard to implement. So let's dive into why this is so important for you to be aware of and what you can do moving forward to work with your care team to reduce that medication pill burden. My work in founding Geriatrics solely focuses on the use of precision medicine, pharmacogenetic testing, and of course, deprescribing. So you may be wondering, what is deprescribing, right? We talk about prescribing all day, but what is deprescribing? And so really, deprescribing has been around. The term was actually coined in Australia by a researcher in the space of harm reduction in Australia. Let's not worry about the history, but ultimately, it is the supervised and safe removal or tapering of medications in a person's profile. This could look like a dose reduction. This could look like maybe combining 3 medications into 1 medication. And of course, it could simply be stopping a medication safely altogether with the supervision and approval of your primary care team. So we're not advocating for people to just stop cold turkey, not at all. Deprescribing requires education, empowerment, an understanding of the medication and its purpose, an analysis of the dose, and is it appropriate for, well, you, the patient. Is this the right medication for me if my kidneys may not be working like they used to? Or say maybe if I'm not taking this with food, or if I have a liver impairment, or even if, say, I have a health condition that can actually be problematic if I take certain medications. Those are the stipulations that geriatric pharmacists like myself specialize in and are able to educate people around how we can start the strategic movement with deprescribing. So let's get into the nitty-gritty of it. Why does this happen? Why do we have so many people on so many chronic medications? Unfortunately, here in the US and along with New Zealand, we are the only two countries in the world that allow direct to consumer marketing of pharmaceuticals. And I can't lie, half of their budget from these pharmaceutical companies are going to advertising, letting people think I need that new drug fast, quick, now, and all that energy. I want that vitality. All of these factors affect our psyche. And so, well, it creates a behavior of having community dwelling people like you and me wonder, hey, should I be on this new drug when I go to the doctor's office? And so there is unfortunately a skewed perspective around thinking medications are benign. I think we all see those commercials. You hear the rattle off the list of all those side effects in that quick little burp at the end of the commercial. But the truth is, we can do so much better when it comes to the movement of deprescribing. And this is why we have to use pharmacists and other geriatricians who are specialized in looking at a medication list, using tools like pharmacogenomics with the NowPatient portal, and finding ways to reduce pill burden. The longer your medication list, the more risk may be present. We define opportunities for deprescribing if a patient may be on 5 or more medications. If you are on 5 or more medications, you may have what is called polypharmacy. Yeah, what does that mean? Essentially, it may mean you have a bunch of medications. Doesn't mean they're all inappropriate, but it means if you're on more than 5, and especially if you're on more than, say, 10 medications, you would qualify for polypharmacy, meaning you may have an increased risk of drug-drug interactions. What does that mean? It means reduced trust in the medications a person may be taking. It may mean you have less compliance and willingness to take the medications. You may have difficulty managing if your medication list is, say, 15 or 20 pills long. Also, this can increase risk of cognitive impairment, falls, constipation, changes in mood. Honestly, there are tons of side effects that can occur, but the older we get, the less likely we're able to really recover from some of those really, really harmful side effects. And unfortunately, the numbers don't lie in this country. In America, we have nearly $528 billion that we spend each year in simply managing people who are not getting the best out of their medications. Meaning, the medication side effects are providing preventable harm. Yes, to me and you, to our grandmas, to our loved ones. $528 billion worth. And that amounts to nearly 275,000 people that die each year from a preventable medication error or side effect. So we really have a ways to go in how we can integrate deprescribing as a safe and structured tool to reduce those harms, to reduce unnecessary hospital visits, to reduce those ER visits, and of course to reduce the costs as well as improve the quality of life so you and I can age gracefully into our seasoned veteran years, the golden age, at home with our family, what matters most. You see, deprescribing has been around. Pharmacists want all of their patients on as little medications as possible. However, we have a health system here in the US that doesn't always incentivize deprescribing. And so the barriers that come up may, frankly, come from a lack of general education and general guidelines. However, the narrative around that is changing. And that is actually why I created geriatrics, along with the amazing work other consultant pharmacists are doing to work with your care team and create a deprescribing action plan so that the care team is aware of how to reduce harm and the patient is now educated on how to ask those right questions to get tapered safely off of those medications. One other opportunity are for our clinician skills, our pharmacists, our people who are doing genetic testing to teach deprescribing to our future prescribers. You see, that's the piece that may be missing. We have to learn how to incorporate safe prescribing habits at the same level as safe deprescribing habits. You see, deprescribing starts truthfully with amazingly sharp and keen prescribing habits. Now, you may be wondering, what can I do about that? I'm just an adult with my own meds, my own life. I'm not a doctor. Ask yourself some questions. Am I on more than 5 prescriptions? Do I have any side effects that I may not have realized have been impacting my day-to-day routines? It could be as simple as dry mouth. It could be you may be having a random itch. But what may be going on in your loved one or your care that may want you to prompt a conversation with your clinical provider? Additionally, what else are we doing to look for ways to reduce that harm? What have we done lately? Have you had a medication review in the last year? Have you had a medication checkup? Have you had a chance to reach out to your local pharmacist and see what they may say and ask, hey, what are some things I can do to get off some of these prescriptions? A piece of deprescribing, truthfully, comes from advocacy and simply knowing what to ask. And so we are leading the movement with Geriatrics, my company, with our Deprescribing Accelerator. This is a tool to help more clinicians, nurses, social workers, prescribers, pharmacists figure out the secret tools to get people safely off prescriptions. But it first starts with an honest medication review. So first, you want to have an accurate list of all the prescriptions that you are taking. And yes, that's going to include over-the-counter prescriptions. It's going to include vitamins, supplements, eye drops, medicated shampoos or lotions, and of course, your prescriptions. And yes, I want to know what you're taking acutely, chronically, and maybe as needed, okay? All of these things matter. And so whatever is getting inside your body has to be assessed with a keen eye. And that is how we're able to assess, hey, maybe you don't need this anymore. You see, when we were in our 40s, 30s, or whatever age it may be, a lot of the medications that came out were developed around, honestly, healthy people of European descent that are primarily male and that are primarily in their 40s and 30s. But as we age, as we turn into the golden years, the body simply cannot clear medications the same way as they once did. And so what's missing in medicine is having this lens of what does this mean now for someone who is, say, 78 or 90? Do we have evidence to show that the medication is still giving a lifetime value versus a lifetime of headache and harm? And so that's the secret sauce to deprescribing, is going through each of those medications from your medication list and truly asking some key questions. One, is that medication vital for me to live? Do I need to be on this medication to live to see tomorrow, right? I know it's pretty fatalist, but that's how you have to really dig in to whether these medications are still necessary. Another question is this medication important for me to live or for my quality of life? Is it important for my general pain management or just general blood sugars, whatever? But is it important? And then lastly, we want to assess if some other medications are at the right dose. Is it the right timeline? You see, we think once you're on a medication for chronic use, well, I'm going to be on that for the rest of my life. No, 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 my friends, that is false news. You do not have to be on all of these medications forever. Some, yeah, I can't lie. There are some medications we're gonna have to assess and make sure it is safe and meant for you to take long term. But certain conditions are honestly reversible. And you'd be surprised how much a change of diet, a change in sleep hygiene, ways to manage stress, ways to reduce your anxiety. Healthy nutrition and exercise can honestly de-prescribe some of the medications that may have been used to treat some of those chronic ailments like high blood pressure or diabetes. There is indeed hope, okay? Do not take no for an answer. So we mentioned compiling a very thorough medication list. Then two, giving that information to your clinical provider or pharmacist and asking, what can we do to safely de-prescribe and get off of some of these medications? You see, we have about 12% of our population in America comprised of merely seniors, right? 65 and up. But what we fail to realize is that that 12% consumes about 30% of all over-the-counters and all prescriptions in this country. And that is only going to grow to about 40% by the year 2050. So we have a ways to go with a growing population with, well, dare I say it, less senior care providers and an opportunity to reduce the pill burden. We cannot assume that every pill for every ill is gonna keep maintaining quality care. It doesn't. In fact, we know that 750 seniors each day in this country end up in the hospital because of a medication side effect. So de-prescribing is not going away. De-prescribing should be the standard of care, particularly when it comes to our older adults who are looking to enjoy those golden years. What are some other potential harms that we see from this overprescribing crisis that we're in? We are seeing increased risk of those adverse events from medications. We are seeing increased costs from our healthcare system, not only on the patient who has to go back, call out of work, and drive to the doctor, take another visit for a preventable issue, but we're also seeing costs on the health system because now that person is using time and valuable resources that could have been helping someone else if it wasn't preventable, right? Another issue we're seeing is reduced compliance, reduced adherence. If less people are trusting their medications or taking them, then, well, you can almost assume the condition that they were using it for isn't being managed. And what does that mean? It could lead to an inevitable stroke or heart attack or any other ailment that may worsen if we weren't managing something that could have been nipped in the bud earlier on. Also, we are finding again that with this increased use of medications, there's honestly a burden on the provider. They aren't exactly quite educated around de-prescribing. You see, it's not exactly taught in all of our schools and training here in the US, but it is becoming more and more popular. So don't hesitate to ask your provider, hey, what are some healthy things I can do to reduce the number on my medication list? Do I really need to be on chronic ibuprofen for the rest of my life? You probably don't, okay? Weigh the pros and cons of what some of those side effects may be causing, and of course, how those medications are associated with those side effects. Another piece of the puzzle is really getting an idea of understanding there are unfortunately other risk factors for overprescribing. Females particularly have a higher risk of being having a higher medication list or being overprescribed. In addition to women, we also do see some health equity and racial barriers when it comes to this. In the dementia subset of patients, we tend to find African Americans have a higher number of polypharmacy or inappropriate prescribing. So we do have opportunities to change the narrative around this. It does start with a healthy dialogue with your pharmacist, particularly if you can find one, a geriatric pharmacist like myself, or of course, your primary care provider. Talk about ways you can figure out what are some healthy and non-pharmacological approaches to manage your care. You'd be surprised how much drinking more water can honestly reduce headaches. And that's something I see so often in an older population that tends to run a bit dehydrated. And so instead of them dehydrated, having to take another Tylenol or ibuprofen for their headache, they'd be surprised if they just drank 2 times more water that they don't have those headaches anymore. And so that's a good example of where we can reduce that pill burden. And so the goal I want you to leave with today is how can we get my loved one to less than 5 prescriptions, okay? On average, I'm seeing patients with 12 to 15 to about 20 medications at a time. And yeah, deprescribing is methodical, all right? We're not just telling people to just stop everything cold turkey. That is unsafe, and we are not advising that. What we are advising is to do it low and slow. Let's pick 1 or 2 that may be opportunities to deprescribe, and then some of them we can stop and just assess how the patient responds. Some medications, though, for instance, like opioids, benzodiazepines, you cannot stop like that. And so you have to gradually wean them over time. And that's going to really depend on the patient's response to the changes in that dose. And of course, that would be done in a supervised and monitored setting with your healthcare team. So deprescribing is not going away, I assure you. Deprescribing is the standard of care for our older adults. And so the future of the aging industry has to see this as a tool. We have to use advocates. We have to use those key questions on if I'm on more than 5, how can I reduce my pill burden? And more importantly, we gotta use genetic testing as another avenue to advocate for meds that may or may not be appropriate for you or for your neighbor, right? So what do we leave with today? We understood that there is a growing polypharmacy overprescribing problem across the world, all right? It's not just the US, it is everywhere. The World Health Organization has already announced that this is a high-risk public health problem, and I would say nightmare that I see in the community setting. So knowing this information, knowing how much we're spending in a system that keeps pushing and pushing more medicines, how are you advocating for less pills? How are you talking to your local pharmacist and building a relationship to advocate for less medications? Have you considered getting a genetic test using that NowPatient service to figure out if this is really the best thing for your loved one? Additionally, do not take no for an answer. If you are having side effects or if you're having concerns in your life or day to day, don't be silent. Use your voice, advocate, ask those questions. If you have an understanding or misunderstanding about those medications, make sure you're clarifying that with your provider. There is no sense going about your day just taking things just because you're told to. You need to have a basic understanding of what this is going to help with and what to look out for if there are any issues that may come up. So I hope you found this helpful. My name is Dr. DeLon Canterbury. I am a board-certified geriatric pharmacist. I'm also known as the Deprescribing pharmacist, here today from Geriatrics. Hope you guys have a great one and see you guys soon. Take care.